Could elevated blood sugar be one of the biggest risk factors for complications from coronavirus and COVID-19? I'm Dr. Brett Scher, the medical director at DietDoctor.com, and I want to bring your attention to an article that we just published on Diet Doctor that looked at a study that had been accepted for publication, where they looked at data from patients who had been hospitalized with the coronavirus. And what they found was even people who didn't have a diagnosis of diabetes, those who had elevated blood sugar still had a significant increased risk of death. And actually, it showed that 42% of the people without a diagnosis of diabetes on admission, but who developed high blood sugars during their hospitalization, ended up dying. 42%. And they would technically be listed as no prior conditions, no underlying health conditions, because they didn't have a diagnosis of type 2 diabetes. Now, we also mentioned in this article how there was a different paper, a review article, looking at the mechanisms of how high blood sugar can potentially contribute to increased risk from infections, whether it's influenza or possibly coronavirus. Now, here's the important point. None of this proves anything, right? These are observational studies, associational studies, but it's starting to add up that hyperglycemia itself may have something to do with it. But the other point is, like we've mentioned before, type 2 diabetes is not necessarily a bimodal problem, that if you don't have type 2 diabetes, you're completely healthy. It doesn't work that way. It speaks to this underlying metabolic disease that so many people have, whether it's insulin resistance, hyperinsulinemia, and the constellation of the metabolic syndrome, that it's going to make you much more likely to probably react with a very high blood sugar when under acute stress or infectious stress. But it speaks to the importance of getting this under control. Right? Again, in full disclosure, we don't have any studies saying if you control your type 2 diabetes and your metabolic disease now, it's going to decrease your risk. We just don't have data like that, right? We can't pretend that we can have all the data we need, but gosh, it sure makes sense that we want to prioritize our metabolic health now more than ever. And the other side of this is if you're treating people in the hospital, maybe it's time to pay a little more attention to the blood sugar. Maybe we don't want to give people the glucose infusions, the D5W infusions. Maybe we don't want to give them the high carb tube feeds if they're intubated. Maybe it's time to pay more attention to feeding them in ways that doesn't raise their blood sugar so acutely. So although the study is full of problems, it's a biased patient population, it speaks to the underlying issues that are becoming so much more prevalent, we're becoming so much more aware of now during the coronavirus than ever before. The importance of metabolic health, not just whether you have type 2 diabetes, but what your metabolic health is, your insulin sensitivity, your hyperinsulinemia, the metabolic syndrome, all the things that can lead up to eventual type 2 diabetes, but still impact your health. Now's the time to take charge. Now's the time to improve your health, not just for the coronavirus, but for the rest of your life. Because it's not just this infection, it's any infection. And it's cardiovascular disease, and it's blindness and kidney disease and amputations and cancer and neurological disease. There's an interplay of our health. And this is one way to really start to take control of your health. So if you want more of these updates on YouTube, click subscribe, go to DietDoctor.com where you'll see our articles. And of course, all our materials that are designed to help make low carb simple, to help you get started on your path to take control of your health and your metabolic health. Thanks a lot, everybody. Be safe, take care of yourself, and take care of others.